Hey there, you animals. The time has come once again for a little data dump. I'm out here in my backyard with my animals. What you don't know is this is take two because I recorded this whole thing once and it didn't even really record. So that's super cool, right? Not frustrating at all. Anyway, I'm here with Coco and Chewy and Ahsoka. They're scampering around beneath my feet. We have a number of upcoming items that some of you know about. I've shared it with some of you in various provider meetings, but some of you don't, haven't either been around to your provider meeting or, you know, I'm terrible at remembering what forums I've shared what information in. So I just figured I would send it out over email and record a video with the various bits and pieces, just to make sure that you have all the information you need. So read on or watch on and shoot any questions my direction, and I appreciate your attention. First, we are going to talk about our non-compete clause or restrictive covenant or non-solicitation agreement, that little bit of our contracts. Now, this will roll out in the second week of August, where you will receive, everybody will receive some sort of communication about this. A few of you will just get a letter saying no changes are necessary, but between 90 and 95% of you will get a letter saying, you know, there's or communication at least, that change is necessary if you choose it. Now, the split here is August 2023. If you were hired before that, then you have a more cumbersome, more restrictive clause in your contract, which is 50 miles from your primary location of practice and 3 years as far as a restrictive covenant. And since then, there's less restrictive terms, which is 25 miles from your primary site of practice and 2 years if you have a panel, like if you're working in clinic, a patient panel, and 10 miles from your primary place of practice and 2 years if you don't have a panel, if you are primarily a hospital provider. So the goal here is to switch everybody over from that 50 miles, 3 years version to the less restrictive version. And this is really to make everybody line up with what's being done in the industry and make our contracts more competitive in general compared to other hospitals. The clause or the switch will also include a provision so that if any federal law is passed in the future that is less restrictive than the terms that we are changing to, then our contracts will automatically default to that less restrictive version that was passed. If it's more restrictive, then it will remain the same so that we are always guaranteed that less restrictive language. So the why is important too, and really I already went over it. It's to be competitive in the industry, but there was a recent FTC ruling that was passed, and some folks will say, well, is it because of that? And that FTC ruling banning restrictive covenants does not apply to not-for-profits. So it doesn't even apply to our contracts. So this is not in response to that. It's just simply to make our contracts more competitive in the industry, and because it's the right thing to do. So that FTC ruling doesn't affect us at all. But the switch in the contracts does. So you'll get that communication, and if you want to take advantage of that, you'll have 2 weeks to decide, and it's just a DocuSign. So that is that. Just email me if you have any questions about that, and I'll, if I don't know the answer, I'll get it for you. Next, let's talk about credentialing, outreach, and supporting our colleagues out west. So our Carle family keeps growing, and that's a good thing, right? But our colleagues in Peoria providing care to the children in that area really do need some help and support, specifically when it comes to peds specialties. So you'll probably hear in the next few weeks about activity where we're getting credentialing ready for a number of our peds specialists, hospitalists, and intensivists to provide telehealth services to the folks over in Peoria. Now, it feels a little weird, right? Because, they're Carle too. Why do we have to get credentialed? Well, the different medical staff or the different facilities have different medical staff offices and medical staff processes. So eventually that might be a unified medical staff office across the whole system. But for now, they remain separate, which means that if we want to provide any sort of service in any of the other facilities, we have to get credentialed. So for now, we're just doing telehealth credentialing because number one, it's easier, but number two, that's all we intend to do right now to support them. Eventually, we may talk about outreach services to either Bloomington or Peoria or both for some of our peds specialists. We also might talk about bringing some of our peds hospitalist colleagues from Peoria over to do or to be able to provide services here in Urbana. But that's all in just discussions right now. But in order to provide tangible support, we'll start on the telehealth services first. So be watching for that, and I just want that to be happening in the background and anybody to catch wind of it and be like, what is that about? So that it's really just to support our friends and colleagues over in Peoria. So just be thinking about that and ways that we might be able to help. Next, evaluations. So everybody at Carle pretty much gets some sort of annual performance evaluation. Some of them get more than one, but there's a group that gets 0, and that's physicians and providers. Just seems silly to me, and I think most of you would agree that feedback is important to do our job well. We're all practicing medicine, right? You know why we're practicing? Because we haven't gotten it right yet. It's just practicing. So I know that's a little play on words, but the reality is I do think we deserve feedback, and I do think we deserve to hear from our colleagues and our teammates, how things are going. So there's a formal evaluation process that's being worked on by our upper leadership teams and Dr. Knight. But in the meantime, I think that we're going to start with something small here in the service line. I envision it to be more of a dashboard to give you a report of what's going on here, but also what's going on with your numbers and your RVUs or, whatever, however you're compensated, how all of that plays out, and give you access to resources to know just how you're doing. In addition, I get feedback and both compliments and complaints about provider teams or individual providers, and I usually pass those along to the right folks to give that feedback, but you may start seeing more feedback directly from me. And that's because I want to make sure that we're sharing information about that, getting feedback from you about what's going on, and try to make sure that if there are any issues or problems or things that we need to address, that we're doing it when it's small, not waiting until it's just built up to something giant and unmanageable. So I want to do that to make sure everybody stays, happy in their jobs, happy in their positions, and feel like, they're able to navigate our complicated healthcare world without worrying about, am I doing this okay? Am I getting it right? Am I helping people? So that's something that's coming down the line, and I would really appreciate any feedback you have about the process, or anything that you want to see in a dashboard type way, something that would be helpful to you that you that would benefit you to see on a regular basis, or just to be able to check. All right, next topic. Dread it, run from it, destiny arrives all the same. And now it's here, or should I say, annual compliance and safety training is. It's inevitable. Yeah, we all love clicking through our favorite annual clickety-doo-dah. But please realize that just taking some time to pass through those lessons and, test out of them, it checks a lot of compliance boxes all at once, things we're required to do for compliance. In addition, it replaces what would now, today, be super long, super boring in-person lectures. Nobody needs it, nobody wants it. So these modules save you from that, essentially. So your one-ups will start to get reports in the next few weeks about who's done it and who's not. I would just suggest, knock them out, just get them done. It didn't take me very long to do them the other day. And just click through and get those bad boys done. The due date's September 30th. I'll provide a link to PeopleFluent in the, along with this video and in the email so that you don't have to go searching for it. Next, engagement surveys. So engagement surveys have always been, or at least provider engagement surveys, these long, cumbersome, hey, here, fill this out. We're checking to see what percentage of you fill it out. And you fill out this super long, answer the same question 14 times, set a, 40 bazillion questions, and you get to the end and you click submit. And I don't know how it is for you guys, but for me, it always felt like it didn't go anywhere. And then it takes forever for that information to get compiled and summarized and then sent back out to us as leaders. And is it really useful at that point? In fact, this year, when we got the 2023 numbers, which we just received not too long ago, and it's July, it did not separate things out into a usable fashion where I'm really looking at just the data from one group to see if I can come up with action items. So I don't know that that process has ever been really useful for us as providers, especially in the smaller provider groups. It's not like we have an army of people to redact the information and make sure that we're not singling people out. So it's just always been a challenge. So going forward, starting in 2025, you'll get a smaller version of that in the first quarter with fewer questions that will help us sort everybody into buckets where we can send out then quarterly, very short engagement surveys that then we can get the information back more quickly and come up with things that we can actually do with the information in a more meaningful way. So we're trying to switch over to a system that will provide more value and get something out of the time you put into it. So watch for that in 2025. I'm still going to take the data that we got from the 2023 version and see what we can do with it. See if we can find some common denominators, or at least bring the information to all of you and discuss it so that we can decide if we want to do anything with it. So that's engagement surveys. If you have any other questions about that, just give me a holler. Next, we'll talk about Workday. So Workday is a system. It's used by a number of different large organizations, both in healthcare and out of healthcare. It combines bits and pieces that we already do, but puts them all in one bucket instead of separate systems. So think of this as something that will include PeopleFluent, but also Lawson, but also LMS, but also your W-2s and your pay stubs. It'll include provider time off requests. It'll include lots of different things that right now we have to access different systems to get to. So it's designed to replace all of those and make it much more user-friendly to get to that information. So we look for that to roll out in early 2025 and be watching for information to roll out in the meantime to show you what it's going to look like and feel like so that you are ready for it and that you know what to do with it when it comes. It will be a cross-platform, so you don't have to be sitting at a computer at Carl to get it. It'll be on your phones, and it will be, from what we're being told, it'll be a much nicer system to use. So watch for that coming in 2025. Another thing is Epic Secure Chat. So we have Epic Secure Chat right now. It exists in Epic, but we're going to use more of the functionality in the future and use it to replace Volt. So if you're in the hospital, you use Volt. but we also use text messages. We also use our pagers. We also use email. This would be a way, you know, when you're in a patient room or when you're going down the hall, we can message each other on Epic, and it doesn't get saved into the patient chart, but it's a way to ping each other for questions or for concerns, things that we need to notify each other about, but it will take the place of Volt, and the nurses will start to use it too. So we expect that in the fall. The original go live date for that was in July. They've pushed it back to September 10th. And we know that when we roll it out, we'll still have both Volt and Epic Secure Chat, and they will gradually sundown Volt as they iron out the wrinkles in the processes for the Epic Secure Chat. A couple things, you can access the information about Secure Chat in a slide deck, which I'll provide the link to. And also, Epic Secure Chat works best with Haiku on your phone. So make sure you get Haiku for your phone, and I'll provide instructions for that as well. Another issue to talk about would be leadership changes. So we were asked by the organization to pull back on our leadership FTEs for physicians. So it's not something we really had any choice about. And it really just decreased the total amount. You'll see some new faces in a couple of the leadership positions. And once we have all of the roster finalized, I'll get information out to all of you so you know what your reporting structure is. For most of you, you already know, or it won't change. But I just have a couple of moving pieces left that I need to finalize before I officially get that information out to all of you. And I think that's all I know right now. I appreciate you getting this far. I want to tell you guys how much I appreciate all the hard work you do, all the great care you provide, all the great stories in provider meetings, and all the camaraderie we have. It really means a lot to me. If you have any questions about anything that we've gone over, or suggestions for content, or anything else that you'd like to go over, just let me know. I'm happy to talk through that. I did just get back from diabetes camp about a week and a half ago, and I fully expect to take you all with me next year. Hottest week of July every year, and it's just down the road at Allerton Park in Monticello. So, I mean, it's not very far away, and I always bring extra stuff, so if you forget something, I'll have it with me. But with it being so close, I do think that taking more folks from Carl would be a good show, and I think it'd be fun, and I'd love to share that place with you because I've learned a lot. So that's about all for today, you animals. I'm gonna get my animals and take them inside because they're starting to pant because it's still a little warm out here. I will see all of you at work, and I just appreciate all that you do. Have a great day, you animals.